A couple things. I'm trying to be up to date in using the modern technology in a presentation, which means no PowerPoint. Sorry, Bill Gates. It's mainly going back to, and this is really called the modern technology, is going back to the dialogue and interactive with the participants. So it's funny how we go in cycle. So I was charged by the organizing committee to give a talk about mainly the link of traceability to the animal health surveillance system, with more emphasis on the global aspect. And I will say, is really listening to the speakers and the panel before that. I thought almost like I am paying them to say whatever they want to say, but it seemed like we have really common agreement on what is needed and how we can move forward. So I try to attempt to address that issue through 3 questions. And these 3 questions, the first one is the link of traceability to animal ID, animal identification. And I will tell you why I'm trying to go back to the basic. And the second question is traceability part of the surveillance system, or it's an alternative to the surveillance system? And I'm again trying to give some argument in one way or other about that. And the third one, which is what are the drivers for implementation of traceability in the United States? I'm planning to demonstrate this through examples and mainly through diseases that are either occurred overseas or currently we deal with, and I will I cannot avoid the domestic diseases here, such as brucellosis, because that also is really how we show to the world how we do have a system for traceability, a successful system to traceability from the beginning. And I really give the credit for our animal health community, including USDA and the state animal health authorities, in terms of trying to do that. So I will try to respond to these 3 questions through other challenge questions. And you could raise your hand in the middle of my talk or throw rotten tomatoes if you have there with you. And you could disagree with me or you could agree with me in that respect. I'm planning to use to demonstrate that through examples with the TSE, both BSE, and BSE stands for blame somebody else, and chronic wasting disease, and also to demonstrate that through listeriosis and brucellosis in the USA. One thing I thought before I will start, to just keep you awake. What's the difference between Dr. Jack Shear, who was presenter before me, and me? There are two things different. He is twice taller than me. And the second thing, he has authority and I don't have authority. So that I think is, but I also will refer to some of his charts and example as we go through that. Any of you here, before I will start about these, what's going on now with listeriosis in the world? Did you hear about what happened in South Africa? Okay, in South Africa there are more than 150 human deaths during the last 12 months due to the listeriosis. There are more than 1,000 cases of listeriosis in South Africa. Okay? Australia has listeriosis they call it rock melon. Anybody who knows about what rock melons in Australia? Is another term for cantaloupe. They call it rock melons. And they exported today, and actually in the news, they exported these contaminated listeriosis, they exported to more than 7 countries. And now they are tracing where the origin of that one. And by the way, the South African, until recently, they didn't know the source. And these are something related to how the traceability is very important. And now, actually, there are another outbreak in Europe, and there is one outbreak also in the United States in that respect. The reason I mention is, again, is even though majority of us sitting in this room say we are interested in animal health, live animals, but in the reality is, in the end, is the product is very important. That's the reason we deal with the animal health aspect. That's, again, my opinion. So, how is traceability related to animal ID? Let me start with this one. And why I am saying with the animal ID? Because in Europe, especially in Europe, is what they call the animal passport. It's very essential for them. The animal ID is the core for their traceability. And I don't think I will disagree with them. You heard, and just from Dr. Shear, and he showed a really good historical picture of the different ear tags, okay? And we have demonstrated through the ear tags, yes, we can do traceabilities. In Europe, traceability has to be on individual animal. And I will say, well, do we need to do that type of precision? And I really would like to say precision. They are more precise in traceability as compared to us. And I would say, like, we don't need that, because we lump animals in clusters. We sell animals in shipment, okay? So if we really understand the reason for animal identification is mainly for traceability. And if that's the issue, then there is no need to go so far on the sake of spending more money to do it on individual ID. And that, including I will get to, including BSE in Europe. Please.
I think there may be a difference between the East and the West. Yeah. And what I mean by that is animals are sold individually in Georgia. There are some lots being sold, but they're sold one at a time. You know, and so...
I respect that, okay? And I haven't lived in all of my 40 years here in the East. But I know some of the system there. The issue here is, even if they are sold on individuals, if you have the identification on the owner or the premises level, you can do the traceability. If today I sell one ewe, okay, coming from my farm, and 3 months from now I sell another ewe coming from my farm, if I have a unique identification of my farm, my sheep farm, then I can do the traceability. In Europe, like in Denmark, in my opinion, is, I like to call it like the luxury animal health program. It's really, that's the best way to call it, okay? Is the 6 stars hotel or something like that for animals' health there. And the reason they do that, because they keep track of every treatment on this passport of the animal. And I can tell you is a good system, don't take me wrong. But you know who are the beneficiaries from this system? Researchers, like myself, from the university. Okay? The industry or the consumers are not really the beneficiaries from that type of details. And this is where I think we need to have a balance. I'm not saying it's not helping, but we need to balance to say what's the cost and the efficiency in the program in that way. When I said BSE when it occurs in the UK, that's where actually, especially European Union, they said, here the traceability on individual animal will work. But how we traced? We traced there on a farm level and on a cohort, what they call birth cohort. Both of those can be done on a premises level. And there is no need for that detail of individual animal level. That's what I want to say.
One of the challenges, William with Valley Example, one of the challenges I have with that, though, is on dairy, calves get shipped to a calf ranch. So you're taking 100 different dairy farmers, sending their calves to one facility, and then they go back home.
Excellent. Excellent example. That were related to the animal movement. Okay? And that animal movement still can be traced back, because these are what they call the dairy calves feedlots. Okay? When they go from California to Idaho, there are X number of dairy farms. They send these animals, and they come back. If the dairy farm in California will keep track on a farm level, how many heifers they sent and how many heifers they received, and how long is that, I think still it can be done. I really believe that this is what I'm saying. The reason I'm not against individual animal identification, but that's by itself, it will cost more than what Dr. Shear indicated in a very nice chart, is the issue about the database. What he said correctly, I don't care what they do with these data. I want to see a link to the data. I want to see the different data sources that they can be related together when he will have a question from that dairy farm to say, well, today you have a TB in your farm, and I really would like to know where these heifers went and when, and how many of them. If the DHIA record, and that's where we need to work with others, if the DHIA record will show when they send the heifers and how many of them they came back with their individual ID for their farm, it's not like related to the national. If the DHIA, I'm just giving an example, if the DHIA data can work or talk with the APHIS data on TB, that's in my opinion much more important than to say, well, I have these heifers, but I couldn't find them how, or trace them in or trace them out because of the individuals. That's my opinion. I really think is we need to have a better animal movement data, and we need to have a much better premises unique identification so we can deal with this type of issues when it comes in the picture. That's my thought, okay? So, and even with the BSE, as I said, they did not use the individual ID. The individual ID now is used by researchers, whether in swine or dairy cows, or even in poultry in Europe, but mainly for research. They are building what is called network analysis. So they can trace, okay, and see the clusters of the animal's movement, which I think is very important. Okay, but how is that related to when they have a disease? How that related to the disease and movement of the disease? When they got 5 years ago, shows my age, okay? 5 years ago, when they got the new serotype 8 of a blue tongue, even with all of this animal ID, individual animal ID and the passport, they could not trace how the source of the blue tongue coming into the northern West Europe. The only thing they could say, and I attended these meetings, they said, here is the network analysis and it shows where the animals went and comes. So can you tell us an idea how this came to this? They couldn't. Okay?
So is that just tracking premise ID only?
They were tracking on individual animal.
No, I'm saying, you talked about not needing individual ID.
Yes.
Is that just premise ID?
Yes. The premise ID, and this is different non-companion animals, in my opinion. I'm really not, again I emphasize, I'm not against the individual ID. But we need to balance in terms of the cost, in terms of the efficiency. But I also would like to say, let's learn from the industry. You heard from Dr. Shear, and I'm so glad when what he said, we are listening to the industry. Today in the panel, and all the respect to the panel members, I really would like to say is, tell us about these food producing companies. What do they do with the tracing? What I can tell you, they have very efficient traceability of their products. Very efficient. Is it perfect? No. But very efficient. But what we want, and this is really and I would say that, is what we want to say, well, we need traceability strictly for animal health. With all the respect, I think that's the wrong way to go. I really feel we said, well, how we can tag in with the industry, with their traceability, so we can control diseases, and when diseases will come, or when the diseases emerge, at least we have the capability to do that. I really think is our traceability, and I'm not talking even today, with all the respect, Jack, is not even for the last 20 years. Our traceability, especially when it comes to program diseases, we were more ahead than countries in which they use individual animal ID. That's my opinion. But what currently we need to be more on the modern technology and move forward with what the industry is using. I feel and Dustin, I'm sorry to say that, is we need to follow on the products. That doesn't mean we don't care about the live animals. But if the dairy industry or the meat industry or the poultry industry, they know how to go back on a batch level to say, well, we know where they come from. Let's learn from it and move it more advanced on the animal level, on premises level, and in that animal level. Animal ID, when I said it cost, Switzerland is rich. You think it's rich. Actually, they pretend rich, okay? Really, because everything is just controlled by it's like a police authority government. Anyhow, in Switzerland, consumers, and this is not current data, I was there in 1998 for a year there. At that time, consumers are willing to pay 4 times the price for a hamburger, so they know this hamburger is coming from sweetie cow and not from a smoothie cow, okay? As compared to go and buy hamburger that they know is just coming from Brazil, for example. Here is our consumers, and when you listen to the food processing companies, they will tell you that consumers' attitude here is different than Europe. I don't think you can go and ask consumer to pay 4 or 5 times the price for a hamburger so they know where the hamburgers comes from on individual level. But During the BSE, this is really like, I can tell you, like, especially among you, like, I mean, during the BSE crisis, what's really like has impressed me, the consumer attitude in North America in the animal health authorities as compared to the consumer attitude in Europe with the animal health authorities. Here is they have much, and this is survey done, by the way, by well-known companies such as McDonald's. So it's, rather than we try to mimic the others, let's try to build a better system using what the industry is doing and moving forward in that respect. Yes. Yes.
So do you think the consumers' interest in traceability would change if we had a major disease outbreak in our animal population?
I am not God to predict, but I can tell you during the BSE, it did not change. And by the way, it was confidential data, but now it's, I think, as they could present. McDonald's did the survey at that time in North America, and McDonald's International did the survey in Europe. And they provide evidence like, no, not change. I don't know if you recall, in Canada, the price of beef went higher when they found the first BSE case there. And the consumption of red meat in Canada get much higher, and their reason is at that time is we want to support the country. Okay? Yes. And by the way, that's not my data. I mean, these are provide with evidence. So if we have this type of consumers, in my opinion, we need to maintain this trust. And to maintain the trust, we need to be more efficient in our system. Okay? I think is, if we have an outbreak from a foreign animal disease, okay, I don't think the individual animal identification will be as important. I'm not saying not as important as premises identification. And especially when we know diseases are clusters and move on a cluster basis. Yes, ma'am.
I think I'm missing something. I'm from New England.
Yes.
Animal food, onesie, twosie. You know, our farmer has a couple pigs, a couple cows. He sells them to a hopefully licensed dealer who takes them to a regional market, and they go to custom slaughter.
Yes.
We don't have heavy industry. And that means what I'm getting is without that industry piece to guide it, and without individual ID being recorded at the very few places that it might be recorded, which would be hopefully, again, a licensed dealer that would record it, or at the market or the slaughter facility, without that individual ID and without that industry pressure, I lose the ability to do the animal health piece of it, because my only chance is to be able to maybe track that 14 number or whatever we're going to then that comes out of it. I don't have, that cow probably came out of a Vermont dairy farm, that dairy steer or dairy bull calf came out of a Vermont farm, came through a market, might have had a health certificate at one time. So it went and got raised as dairy beef, but then, you know, someone in the South Shore sold it to someone else, and it went and fed there for a while. They bop around, and we do not have that kind of movement documentation. And my state is not going to make interstate movement requirements. It is nowhere on their priority level. So without the individual ID, and you know, I don't have that cohort movement. I don't have that ability to fulfill that animal health function of traceability. Is that?
This probably varies by state to state, but in California, when one of our clients wants to tag their baby calves, we convince them to get a premise ID, because we're going to have, whether they use RFID or news tags, whatever the case may be, you have to have a premise ID to get those tags. At least we know the origin of where those tags originated at.
That's what I meant, by the way. Unique premises ID. So
But
to
I know if that's an Angus cow that, or, you know, some generic black cow that moved, there's nothing stipulating that it's ID'd in the first place.
Yeah.
Right? So, you know, I agree. I can get it back to the premises, but
well, it's to go back to your scenario.
yeah.
That cow went through at least 2 farms before get to the slaughter plants. Is that right?
Sure.
Or 2 premises. I will not even call it
2 farms.
2 farms. If there is, these 2 farms have unique ID, okay? Following what Dr. Shear shared with you, the trace in and trace out, okay? You could follow on that cow, and you could follow on the movement of that cow.
But what if he's got a field full of 50 blackish steers, and, you know, he sells 6 of them here and 6 of them there. I need that individual ID to know which of those 6 steers they were.
It's when you look on the back tag at I don't know if Jack, if it's still used, the back tag you show it as is still used. Okay, the back tag. Okay. Well, the back tag is by batch, and and I'm not really I'm not so old, but in the 80s, APHIS through one epidemiologist did a study to show the efficacy of the back tag. Dick Farah, I don't know if you remember, from Texas, and he showed he could trace back at least 70% of them. Okay, 70%. So when you told me, you told me that farmer has 2 different Black Angus, and he sent to Joe Smith, and then another one to whatever other name, or to the slaughter plants, that's part of the trace back.
Right.
And I don't think you need that individual animal ID to find what happened to that. That's one thing. The other thing I want to say is, majority of the time, we are dealing with diseases that are clustered. It's contagious diseases, infectious diseases. So if you will ask me, if he sent 1 cow to the slaughter plants, and that cow was identified with infectious, okay, I will consider all the other cows also could be infectious. So it doesn't matter whether they went to X or Y. Yeah.
So
Yeah.
these animals, each one of them has ID on them, but they're a premise pin tag type.
Yeah.
Not individual numbers,
Okay.
just premise numbers.
Exactly.
Animals got one.
Okay, there is something on the cow.
Yes. Yeah.
Thank you. That's
like the scrapie. What I'm saying, I continue saying, and maybe I should, individual ID. Okay, I'm saying individual ID. I'm not saying the cow will go to the slaughter plants just by Black Angus. It has to have
It's not a naked cow. It actually has something.
It's not more Salman cow. It's it has to have a unique. And I continue saying unique. Yes, yeah.
This is great discussion, but I just wanted to let you know that you've got a minute to wrap up what you want to say.
Is traceability part of the surveillance? I'm sorry, I was giving that. Or is an alternative approach? In my opinion, surveillance would not survive and would not be efficient if there is no traceability. So traceability is essential for the surveillance. Okay? And without that, it will be really is just something in the air. Okay? What are the drivers? Okay? For the adapting traceability. And this is where I think is the panels discussed and whatever, and the other people. In my opinion, the most important drivers is money, economic incentive. And the economic incentive will come from the private sector. And if the private sector is using traceability, I am again repeating that, let's try to see what they are using that we can build on it and move forward. Finally, you mentioned about the Zika virus in California. How many of you hear about SARS corona? We should be prepared for that. And I think that is coming soon. And I will be in China this coming week, and I hope I will not be addressed with that to see what's going on in China about that disease. And No, I will bring the virus in my pocket and just wait. Thank you again. I'm just really yes.